and short slideshow regarding what is the benefit exercise for stroke patient. So I'm going to tell you what is the difference between a patient that doing all the exercises and what is the difference between the patient who not doing any kind of exercises. So it will be a lot of difference because 2017 study shows that a lot of stroke patients they are not having enough of exercises. So we as healthcare provider, we should able to show them, encourage them to do all these kind of exercises. Okay. So this is I split it into a few main point, which is the first one is strength. An exercise which is designed to improve their strength will help them a lot in their life, which is to improve their activity daily living. What is activity daily living? Is the way they are climbing up and down the stairs, going in and out of toilet. So bear in mind, our main focus for exercises is we want the patient to become independent. All exercises that we construct and design are for them to become independent. Because a lot of stroke patients, they need us to help them. So it's our job to make them to become independent again. So next one, also strength, is to improve their muscle power for their lower limb. So a lot of stroke patients, they have reduced in muscle power. So the main goal to increase their muscle power on their lower limb to reduce the risk of fall. A lot of stroke patients, they have recurrent stroke again because of fall. So we need to strengthen their lower limb also. Next one is mobility. The main reason we doing mobility exercises is to increase their range of motion. A lot of stroke patients, they come with rigidity. What is rigidity? Rigidity is stiffness either in their upper limb or in their lower limb. So it is very important to show them do all exercises so that they will able to achieve full range of motion again. And next is balance. This is very important because bear in mind, stroke patient, they are not always lying down. They need to walk, they need to go to toilet. So they will encounter slippery surface and uneven surface. So by design and exercises that improve their balance, they will be able to overcome this kind of situation. Okay. Next is coordination. Coordination is very important because a lot of stroke patients, they need help to eat. So by doing a good coordination exercises, they're able to eat by themselves by holding the fork and spoon by themselves. So next one is swelling. A lot of stroke patients they will call edema. Either in their upper limb and their lower limb, they will have it. So by doing movement, it will help to activate back their lymphatic system. So last one is pain and fatigue. So not only pain management reduce their pain. So exercise also can help reduce the pain. By doing exercises, the muscle will become stronger. So it will help to reduce the pain and also rewiring the nervous system pathway. For endurance exercises, it will help to reduce the neurological fatigue. So this is the tips on exercises for stroke patient. A lot of stroke patient they stop halfway. At physio department also we have this kind of problem. Even 5-6 session and they suddenly stop. This is why. First one is they did not find that physiotherapy or exercise is enjoyable. A lot of stroke patients they comfortable by doing one-to-one session. So we need to know what they want. And others are comfortable by doing group exercise therapy. It helps them to become motivated and competitive, which is very good for them. Okay, next, start slowly. A lot of stroke patients, they tend to do too much on the first day. For example, they are acute stroke. They are unable to walk. So on the first day, the mindset is, I want to walk today. Which is we need to explain them and encourage them. This process takes time. You need to start slow from step 1, step 2, step 2, step 3. It will take time. Next is exercise need to become a habit. Okay, what I mean by that is, a lot of patients, they're only doing few exercises in one day, which is, for example, one exercise in 1 week, which is not good. So we as the therapist and medical practitioner need to encourage them to do more exercises. For me, I always advise my patient, after breakfast, you do 10 times this exercise, 10 repetition of the exercise. After lunch, you do 50 times of this exercise. And after dinner, you do another 10 times of repetition for these exercises. So by doing it every day, then it will become a habit. Okay, last but not least, seek professional support. Okay, so for stroke patient, they also need professional support. Even though they are 90% cure, they still need professional support to monitor their condition, even to construct a new set of exercises to help them to become more independent in their activity daily living. Okay, this is how to handle a stroke patient safely. First is the transferring technique. So in the last slide, I'm going to show you, demonstrate to you how to transfer patient, how to ambulate them, what exercise, simple exercise they should do, and if the patient come like 5 patients, what should we do as a group exercise. Okay, for the transferring technique, we should know where to hold the patient, because a lot of patients, they come with subluxation on the affected side. So if you place your hand wrongly, for sure it becomes dislocated already. So you should know where to place your hand. So next one is contracture prevention. Like I just said just now in the mobility exercises, a lot of patients, they come with rigidity. So it is very important to help them to achieve their full of range of motion, or they will become contracture for the rest of their life. It is very difficult to cure contracture. Next is bed sore prevention. As we know, the nurses have their turning clock system. So advise the caregiver to do the same at home if they are discharged from the hospital. Next is ways to ambulate the patient. So for us, the therapists, we are not 24 hours by them, by the side of them. Even the nurses also. So we will educate the caregiver how and what is the correct way to make sure the patient able to go from bed to toilet. Lastly is a proper body mechanic, because with stroke patient, you will face a lot of lifting, a lot of ambulating, so you need to know what is the proper body mechanic, how to lift up the patient, and ways to ambulate the patient. Okay, so for demonstration, I divided into 4 kind of exercises. The first one is transferring and ambulation. I'm going to show you later. Next is bed mobility exercises, how to make the patient from lying to sitting, sitting to standing, standing to walking in the safest way as possible. Next is functional activity. This is very important on how the patient become independent by eating themselves, doing house chores and everything. Last one is group exercises. This we all going to do together. I'm going to show you the simplest way how to make the patient able to move by themselves. Okay? Okay, the first one is bed mobility exercises. Okay, Zah? So for example, the patient from lying, we want to make them to sit position. I have 2 methods. The first one is us physiotherapy do it. I'm going to just show you, just to let you know how we do it. Okay, for example, the patient is in lying now. So for therapists, they have one technique to make sure the patient is safe in sitting position. And please notice my hand placement also. For this one, only us therapists do it. Hands behind the neck, and another hand is behind the knee. Ready? Body mechanic, make sure you do it right with momentum. 1, 2, thing. This is the safest way for us Rafi to do. But if you are the caregiver, you cannot do like this. So how to do it? For example, this is the stroke side, the left side, 1 and 2. So first one, bend the knee, and then the other hand, cross and hold the bed. If you cannot see, I change to the side. For example, this is the stroke side. Okay, this hand hold the bed, and then this knee bend, and then cross. So ask them to hook the stroke leg and ask them to push down. Push down. Use your hand. Pull yourself up. We just support only. This is to make them become independent. So this is how to make sure them from lying to sitting. I'm going to show you one more time. The patient with yourself. What's me? First, okay. Hook. Push down. Push your hand. Get up slowly. See? So we need to encourage them that they can move by themselves. That is not possible at all. The patient, whoever have stroke, they will have a other good muscle power on the unaffected side. So always encourage them that they can able to do it by themselves. Okay, next, from sitting to standing, using chest. Okay, next, what we need to know is where's the affected side. For example, the affected side is here. Okay, so I need to support on the good side. I'm going to show you why. Okay, first I'm going to support the knee, and then the other hand I'm going to place on the waist, which is, this is the stroke side, is it? So I'm going to place on the waist, not on the shoulder, because if I lift him up, for sure shoulder becomes dislocated. So I only place on the waist only. Okay, you can also use strap or draw sheet or anything that you can wrap around them. Okay.